Diabetes is a serious chronic health threat.
Diabetes.
Type 2 diabetes.
With diabetes.
Type 1 diabetes.
Diabetes.
About diabetes.
Diabetes.
Anything can go wrong.
Pre-diabetes.
Diabetes.
Diabetes.
It's amazing how much everything affects your blood sugar.
First night she did our garage, and next night I guess she decided she wanted to finish the job. So by the time we discovered it, it was well underway. So I went right across the top of the house. But that's the night that he started the first foot infection, trying to get out. And he did just got out when the garage collapsed. The side door.
I ran around and checked it, and I stepped on the fire.
When he was running out, his bare foot, he was running out of the garage. And that's when he got a little bit of an ember in there, which we didn't know until about 4 or 5 days later when I was doing I was treating the callus, is what we were doing. And we were living in the hotel at that time. And I could see this little dark spot in the middle of the callus. And I kind of picked at it and it fell out, and it was an ember, you know. And then that's where the infection started. It started, and it just kept getting bigger and bigger and bigger. And we went to the foot doctor, and he was kind of treating it, but the infection was there. And of course he went in the hospital. You know, they'd put him in there and they would give him intravenous antibiotics or intravenous, 5 days at the hospital on a day program. And then they stopped it, and it just, nothing happened. And he was on oral antibiotics, nothing happened, just kept getting bigger and bigger and bigger until finally, I think it was the foot doctor, he said, you know, I don't want to touch it because it was infected. It was so badly infected, and I've got pictures of it, and it was so badly infected that they had to just cut everything out. So they cut out a lot of the bone, they cut out a lot of the muscle that's there, so of course the toe went, you know. But it had to be done. And of course, luck would have it, the surgeon was backed up and we couldn't get in, and then there was another doctor there. And she says, I think I can save that foot. So thank God that the other doctor was backed up. Yeah. So, you know, he's had 2 operations on this foot to dig out the actual infection. And the first time was 17 days in the hospital. And then they come home with the thing to your heart, and then you got to give injections. So he had that for 6 weeks at home, just, you know, because of that, the infection was so bad, trying to save the foot, which we did. He's diabetic and he gets these sores, and apparently that's quite common with the people that have diabetes, you know. And we've met a few people in the hospital that, you know, that have gone back and forth. And actually I met one man when he was in there and he said he was basically going to lose his feet because it had been 6 years for him, and they can't, you know, they can't do anything for him, and he can't walk. He was in a wheelchair.
But you know, those doctors, you know, when they do their work on you, and you're ready to leave the hospital, they'll come and stand there and they do the 1,000-yard stare. And they say, Richard, you know, if this happens again, I don't know if I could save you. I've been lucky, really. You know, I just turned 83 years old, and I'm still in pretty good shape, except for my feet.
We check his foot every day, you know, even when they're good. We check his, and you know, and because he'll say, you know, I can always tell because he gets a little swelling on the top of the instep there. I say, let's just take a look at your foot. And sure enough, there may be one little spot. And if we're not on top of it right away, sometimes we can catch it right away. Sometimes it gets full-blown infection. But so far he's kept them.
Along with macrovascular complications like heart attacks and strokes, we're also concerned with microvascular complications, which affects our eyes, our kidneys, and our feet. The reason why the small blood vessels are affected is due to our body's inability to supply blood flow to these areas. Here's a demonstration of that effect. When blood sugars are controlled, the blood is more fluid and can properly deliver oxygen and nutrients to our cells. High blood sugars turn our blood into sticky syrup and make it harder to nourish these areas, leading to death and damage to the tissues. Add high blood pressure and hardening of the arteries from cholesterol and inflammation to the equation, and the situation becomes much more serious. These are the symptoms that bring people in to see their doctor or into the emergency room. But unfortunately, by that point, the damage is already done. That's why it's important to put a monitoring plan in place so that we can catch these issues before they become a more serious problem.
In the emergency department, you'll see a little ulcer, because your shoe was rubbing on something, and then it just festers and grows and grows and grows and grows, and eventually the foot is necrotic, so the tissue is dead, and we actually need to amputate it. Or even peripheral vascular disease is more common in diabetics because of that plaque formation, and so sometimes we even have to do below knee, above knee amputations because of their diabetes. So the diabetic neuropathy affects patients daily in the emerge because it means you can't feel your feet. So if you step on a rock or something and it causes a cut or something, then that just gets worse and worse and worse and gets infected. And if you're not dealing with infection because you can't feel it, and you think, well, people surely check their feet regularly. Not really. If it's on the bottom of your foot and it's hard to see, then you're not going to see it until it's a really big problem, and then you have to come to the emerge. It's sometimes hard too because it's not like you can't see the immediate, harm. And that's why sometimes diabetes is a dangerous disease, because it's like, okay, well, my blood sugar's high, fair enough, but I feel pretty all right. But it's until oh, well, now I don't have a foot because I let my blood sugars go out of control. I developed diabetic neuropathy, or, oh, I ended up in the hospital with diabetic ketoacidosis, DKA. And so that's kind of, the harm or the risk that's associated with diabetes, or why it can be so dangerous, I should say.
It's super important, to always be checking their feet. So make exercise, trying to get that excess blood sugar out of there. That's what we know leads to some of these neuropathies and killing off of the nervous system. So some of the things that I get people to do is always checking their feet before exercise. I get people to use a spiky ball and put it on their foot, and it helps to just bring back some of that brain-foot connection and being aware of that sensation of the foot. So I get people to try that. Sometimes with the feet and the neuropathies, it gets really painful, really burning, sharp shooting, and it's I can't touch my foot. So sometimes I get people to do what I call desensitization exercises, where they're actually calming down those symptoms. And that's as simple as just, playing with your feet, touching your feet, being aware of them, or, taking a soft cloth and rubbing them on those areas where it's hard to feel or it's painful, and they're progressing to more coarse material. It's really hard to feel where their feet are, and they have some decreased sensitization of their feet. So sometimes I've seen a stone or a pebble get into their shoe, and they're not aware that that happens, and it can wear into the foot. And then, with a slow healing factor, that it doesn't heal very well, and then things just spiral from there. So having good footwear and making sure you're always checking your feet before you exercise is something that's really important to do. A lot of people have trouble with extreme temperatures, so not exercising in extreme temperatures, cold, hot, those kind of things are very important.
No, we went through a lot of special shoes, special monster-looking sandals, and with all the pressure points, but then they get that pressure point with those shoes, and then another sore will start up someplace else. So, I mean, it's like a battle.
I used to walk around the town here every day. I can't do that now because those sores, they spring up. And I got a bicycle that's a really nice bicycle. And even that, you put your feet on the pedals, and it hurts. So I don't know. I'm going to try it with this stuff and see if I can, because I enjoyed that.
Diabetes Canada has a great reference for proper foot care that's important for all people with diabetes to follow. Here are some of the tips for what not to do. Don't cut your own corns or calluses. Using anything sharp around the feet can create a way for bacteria to get in. Don't walk barefoot to avoid issues related to temperatures. Don't use lotion between the toes. Don't wear anything tight that can further restrict blood flow. And don't use over-the-counter medications to treat corns and warts. Some things that they recommend are wearing properly fitting footwear to minimize rubbing and pressure sores. Avoid extreme heat or cold. Check the color of your legs and feet, as well as look for cuts, bruises, blisters, sores, and anything unusual every day. And have your healthcare team regularly check for neuropathies using the monofilament test.
What the monofilament test is actually not technically super hard to do, but it's a special little filament that you basically just test if they can feel it or not. But we know that there's a shortage of family doctors, and most of the family doctor appointment times are only 10 to 15 minutes. So if you're bringing up 2 to 3 issues, sometimes the monofilament test gets put on the back burner. If you're having difficulties getting your diabetic neuropathy checked or monofilament tests, walk-ins aren't ideal, but that's somewhere if you can't see your GP, your family doctor for months, sometimes that's an avenue you can go. I know that their diabetic clinic nurses or diabetic teams are coming up more and more often. And I think that's great because, like you said, family doctors are so busy. So the hope is that you can get that done there. One of the other simple things besides the monofilament test that you can do is getting your eyes checked regularly. Because diabetic retinopathy is a thing, and it really sucks when you can't see, because then you can't check your feet at baseline. So
maybe my eyes are starting to go away.
Oh, I don't know. You read a lot, so I don't know.
Well, I do read a lot, but it seems like I can't use my eyes for very long, and because it seems like my eyes get tired.
And he gets it checked every year. And if there's any change, he gets his lens changed every year. So
Too much sugar in the blood can cause damage to the back of the eyes in a place called the retina, which is responsible for helping with vision. Some early warning signs that there's damage occurring is changes of vision, blurriness, spots and blotches that suddenly appear, or flashes of light. That's why it's important to get our eyes checked regularly and follow the ABCDEs of diabetes to maintain healthy eyes and vision.
he goes every 3 months for A1C, and he checks and he goes for blood work for check the kidney and function and everything else. And he's been good, So, yeah. So like I said, it's just basically the feet.
The kidneys are responsible for filtering toxins and medications from the body. Uncontrolled diabetes can cause damage to the little filters in the kidneys, making them leaky and ineffective. In certain situations, medications have to be adjusted or even held in times of illnesses or dehydration to prevent further kidney decline. There are also many natural products and over-the-counter medications like ibuprofen and decongestants, which can worsen kidney function. That's why it's always best to check with your healthcare team before starting any medications or supplements. While we're on the topic of medications, we can use this flowchart by Diabetes Canada for vascular protection and diabetes. If we determine that a heart attack, stroke, or macrovascular event hasn't happened, we can continue to assess whether there's any existing damage to the eyes, kidneys, or feet. If so, it's recommended to be on a blood pressure pill with evidence for vascular protection and a statin to lower cholesterol and inflammation in the blood vessels, leading to hardening of the arteries. There are also certain blood sugar pills that protect against certain vascular disease, and it would be beneficial to optimize therapy with your healthcare team. If there aren't any microvascular complications, we can look at whether you're over 55, where blood pressure therapy would be warranted, or if you're over 40 years old, or older than 30 with diabetes longer than 15 years, where statin would be prescribed due to evidence of slowing down vascular complications associated with diabetes.
When we were growing up, we didn't know anything about diabetes. But,
But your family had diabetes.
well, didn't my mother have?
Your mother had diabetes. Your aunt, one of your aunts had diabetes.
Yeah. Yeah.
She lost her one leg, didn't she, from diabetes? Your mom's youngest sister?
That's right, yeah. Yeah. I forgot about that. But I don't know if they realized they had diabetes. Uncle Buck had diabetes too. He lost both his legs when he was in the home. But nobody really knew that much about diabetes. It's
Well, yeah, I think in the years ago it was like you'd have 8 grapes or something, and your diet was really, really limited. You had to really count the calories and cut back on making desserts, and because I used to make dessert every night and big meals, and more greens and instead of a lot of potatoes and starchy vegetables. So I cut back on those, and then more salads but it worked out. I would say just be aware of your own body and get checked every year. Go for your medical, go for your blood work, and just at least once a year, because you just never know. And the doctor's going to say either you're borderline. If you're borderline, change your diet, change your lifestyle as much as you can, because if you don't, then you're full-blown diabetic, and that's something you don't want to be. And that's what happened with us. Mind you, he had warnings and warnings, but it'll never happen sort of thing, and it did.
Well, your whole life is, look after yourself and your other half, because, if you don't, you're going to fall into something. I think we're happier now than we ever were.
Thanks again for watching and learning how to keep our blood vessels and organs healthy. Next episode, we'll talk to Caleb, who was diagnosed with juvenile type 1 diabetes in early childhood, some of the challenges he and his family have had to overcome, and how he has maintained a positive attitude with the help of the community.